Hi there, this is the part 2 for one concept to different exam style questions worldwide on the topic asthma and COPD. If asthma and COPD questions confuse you in exams, this 30-second concept will fix it forever. Subscribe for daily exam saving medical concepts. So, one line memory lock. Asthma is equals to ICS first, LABA never alone. And in the case of COPD, LABA or LAMA first, LABA allowed alone. So remember this concept. We will move to the next question. The question is in the GPAT format style, which is a Indian competitive exam. The question is which of the following statement is true regarding asthma and COPD treatment? Options are option A, ICS alone is effective in COPD. Option B, LABA alone is effective in asthma. Option C, ICS is the cornerstone of asthma management. And option D is leukotriene antagonist are useful in COPD. Here the answer is C, which is ICS is the cornerstone of asthma management. So, the statement which is true about asthma and COPD. So, remember the rule asthma treatment always start with inhaled corticosteroids, ICS. So, here the option is ICS is the cornerstone of asthma management. If asthma is mentioned, then think ICS first. The next question is in the format of NCLEX, which is a nursing exam style. So the question is a nurse is educating a patient newly diagnosed with asthma. Which instruction is most important? Options are A. Use LABA inhaler alone daily. B. Use inhaled corticosteroids daily even without symptoms. C. Use montelukast for acute attacks. D. Stop inhalers once symptoms improve. Answer is option B. Use inhaled corticosteroids daily even without symptoms. So the question is stating that a nurse is educating a newly diagnosed asthma patient. When you think about the asthma, logically think that ICS prevent future attacks. Even when symptoms are absent, then we have to give the treatment. Stop inhalers when symptoms improve. It's a very dangerous. So control inhalers are preventive, not rescue. So coming to the next question, which is MRCP UK postgraduate style question. Here I am just focusing on the concept. The question frames will be the different, but the concept will be the same. So remember the one memory lock concept for asthma and COPD. For asthma, we have to focus on the inhaled corticosteroids first, then LABA next, and for COPD, you have to focus on the LABA or LAMA first. And LABA alone is allowed in COPD, but in asthma, only combination therapy is allowed. So coming to the question, which pharmacological difference between asthma and COPD is most accurate? So what will be the pharmacological difference between asthma and COPD here? The options are ICS are the first line in COPD. B is LABA monotherapy increases mortality in asthma. Option C is montelukast is first line in COPD. Option D is biologicals are routinely used in COPD. So the answer is B. LABA monotherapy increases mortality in asthma. So here we can apply elimination method. First option is ICS are first line in COPD. No, ICS or not. LABA is the first line for COPD. And coming to the option C, montelukast is the first line in COPD. No, montelukast is not a first line. First line is LABA or LAMA. Option D is biologicals are routinely used in COPD. No, biologicals are the last option which is used if all the therapies are failed. So here the correct answer is LABA monotherapy increases mortality in asthma. So coming to the next question, which is a format of match the following, which is commonly seen in Asia and Africa. So here the question is match the disease with correct first line treatment. So the disease is asthma, COPD, and option A is LABA or LAMA. Option B is inhaled corticosteroids. So here, what's the correct match? Correct match is for asthma, inhaled corticosteroid. For COPD, LABA or LAMA. So the next question frame type is assertion and reasoning type. So guys, remember the one concept of memory lock concept is asthma is equals to inhale corticosteroid first and LABA next. For COPD, LABA or LAMA first and LABA alone therapy is allowed in COPD. So coming to the point assertion A, LABA should not be used alone in asthma. And reasoning is asthma is primarily an inflammatory disease. Is this true or false? Yes. So what will be the answer for this? So both A and R are true because reason explains the assertion because asthma is an inflammatory disease. So that's why LABA is not used alone in asthma. So we are focusing on first inhaled corticosteroids. Here is the table based question. So a comparison table shows ICS as first line in asthma and LABA or LAMA as first line in COPD. Which inference is correct? So the options are: A is LABA monotherapy is dangerous in asthma, B is ICS monotherapy is effective in COPD, C is montelukast acid is essential in COPD. Option D is biologicals are used routinely in COPD. So here you can apply elimination method as well as you can focus on the pharmacological events. So if the table shows ICS for asthma and LABA or LAMA for COPD, first interpretation that means LABA alone is dangerous in asthma. So the correct answer is LABA monotherapy is dangerous in asthma. Here you can apply the elimination method such as, first of all, ICS monotherapy is effective in COPD. No, because in COPD, first you have to give LABA or LAMA. Montelukast is essential in COPD? No, montelukast is not essential. Option D is biologicals are used routinely in COPD? No, it's a last option. So focus on the one concept, memory lock. Important type frame question is one line rapid fire. The question is the most important pharmacological difference between asthma and COPD. So the correct answer is A, option A, role of ICS. So remember the one concept, one line, just asthma is equals to inhale corticosteroids first, the LABA next, and for COPD, LABA or LAMA first, and LABA or LAMA alone is used. Save this series, these questions repeat worldwide. Comment more MCQs for next part.